Well, I had a dental checkup and I had a very loose tooth, and a couple of weeks later it fell out. So I phoned my dentist Gareth and went back to see him, and he discussed whether to add another tooth onto the plate or just leave it, or he mentioned the possibility of having implants, and he said go away and think about it, which I did, and then went back to see him, and the plate was so uncomfortable with this other tooth missing that I decided that I would like to hear more about the implants. So he mentioned coming to Elmsley House. Well, my first appointment, I saw Brigitte, and she took me through it, explained all about implants, and we discussed the possibility still of a full denture, because I was definitely made up my mind I was going to have it full no matter what, to get it over with once and for all. And she took me through it all. She took lots of x-rays, and she was really good at that, showing me how they could build it up slightly to make it more level, and explained everything in detail, and then wrote a letter to me explaining it all as well, and said, you know, to phone if I needed any more information. I came back and saw Brigitte again for a second appointment to discuss having got more detail of what it was all about, and she went through it all again and said she'd discussed it with Tim and it was a possibility, and explained it all again. We went through it all again, which was really helpful. I went away again and thought about it and definitely decided I wanted to go ahead, phoned up, and then I came back and met Tim, and he explained it all again for me. We discussed it all again, obviously to make sure that I was fully aware of what I was doing and how happy I would be. And then on the final appointment, the whole team was there. It's like a case conference. It was great. I felt very important. I think what they're going to do is to actually implant the teeth into the bone, which will take quite a while to settle, obviously, and it's going to take about 4 months before I get my final teeth. But I won't have to go without teeth. I will have a full set all the way through, which would be nice. I think having this treatment and the full implants is going to be a lifesaver for me. I've had problems with my teeth all my life, really, one way and another, and I think to have this finally done will just give me so much more self-confidence, and I won't have to worry anymore. I've been having ulcers, I've been having to watch what I eat, and all of this hopefully will be gone and I can have no more worries. I don't really have any worries about the procedure. Obviously, when you're going to have something major done, you've got a few concerns, but everybody has been so good, and I've got every faith in Tim. Having spoken to the whole team, I think the sooner I can get it done, the happier I should be. I came in for my surgery at 8:30 in the morning, so I had to be here early. I was a bit apprehensive, of course, but I was so keen to get it done, so I think that counteracted it. Everybody was great, they're very friendly, made me feel relaxed, and I took some sedative and had the injections, which weren't as uncomfortable as the last ones I'd had. And I've really can't remember very much more. I was aware of people around me, but because I wasn't completely out, but there was no pain or anything. And I remember coming to a couple of times, or a bit more, having a bit more of a sense of what was going on around me, but very little. And I had a break for a while after the main surgery was done, before the teeth were fitted, a couple of hours later. But even then, I was aware of him doing something, but not not a lot of what it was all about, and it wasn't painful at all. And I think I went home mid-afternoon, and I was able to eat, but obviously nothing too sort of, not a rump steak or anything. I had some soup. And then the last thing I know was my husband waking me up, or the next thing I knew, it was my husband waking me up to say it was time for bed. It was about 10 o'clock, and I'd slept all through the evening. So and then the next day, I was fine. I had some antibiotics and painkillers, which I was advised to take for the 5 days, which I did, and I had just a little bit of discomfort, nothing more. So I was very happy. Since I've had my new teeth, it's very difficult. I mean, every so often I forget and go to take them out to clean them, and it's not there. I think, oh, wonderful. So it feels so good. You tend to forget what it was like before, because it just feels so natural. And I'm sure as my mouth gets more and more back to normal, because it's still a little bit, the gum is still a little bit swollen inside, it's going to be even better. And quite honestly, it's just so natural now. You forget how bad it was before, and the ulcers and occasional discomfort when the plate moved. But other than that, it's just been great. Well, I was so pleased with the treatment that I'd recommend it to anybody. I mean, I was playing golf today, and I mean, every time I go out with friends, they're all saying, how's it going, you know, and they can't believe how good I am and how relaxed I am about it, because they know I don't like going to the dentist. I mean, I'm not too bad with pain considering, but I've never liked going to the dentist. But everybody here was so helpful and reassuring. As I say, I was so pleased with them that I've recommended them already to several friends. That I was so apprehensive beforehand, but I was treated so well here, and it was so natural that I'd recommend it to anybody. I just couldn't ask for anything better. So I'm sure it will get better and better, especially when I get the final ones in, and I can clean them more properly, and because at the moment I can't clean them really well. But I think within a few more weeks I'll be able to, from what Tim and Andres were saying.